Figure here shows the H&E staining revealed the non-appearance of glandular structures due to the invasiveness of the tumor and the presence of low severity of microcalcification with pleomorphic nuclei, PN. Furthermore, the tumor cells convey a lack of differentiation and anaplastic duct cells due to the dysplasia and malignant transformation. An abundant eosinophilic cytoplasm, EC, along with the low numbers of mitotic figure, MF, give the diagnosis of grade 2 invasive ductal breast carcinoma, demonstrating the tumor to have some differentiation with low aggression, as signs of metastasis was not evident due to the absence of lymphovascular invasion. This invasive ductal breast carcinoma spreads irregularly through the desmoplastic stroma, DS. Usually when carcinoma cells penetrate the stroma, they originally invade the fibrous tissue, then the fibroadipose, and lastly the adipose tissue, AD. Myoepithelial cells portray a lack of visibility with invading malignant cells, which have breached the basement membrane and have resulted in the invasion of the stroma due to the constant proliferation. Furthermore, malignant cells have been observed in Figure 1 as they ideally form the hallmark solid nests, N, architecture and ductal structures. Using myoepithelial biomarkers promote the ability to differentiate between invasive carcinoma and benign proliferation, of which have similar morphological features, thus judging the keratins CK5 and CK14 having high molecular weight can distinguish between ductal hyperplasia and low-grade ductal carcinoma in situ. Once some myoepithelial layer have been breached in the basement membrane, the high abundance and antigenic nature of keratins are seen. Typically, mammary epithelium cells consist of basal keratins, though are lacking in tumor cells. With concerns to slide A and B, negative results were produced. This is usually indicative of ductal carcinoma cells. The notion of the diagnosis being invasive ductal breast carcinoma was furthermore strengthened due to the negative smooth muscle myosin. Both estrogen and progesterone receptors produce a positive result using IHC, having a quick score of 5 out of 8 and 8 out of 8 respectively. Estrogen receptors concentrations are higher in tumors of postmenopausal women in comparison to those of premenopausal. The fact that there is presence of both concern receptors conveys a notion of cancer growth. Presence of both receptors highlights the possibility of a better prognosis due to its better interaction it may have towards hormonal therapy, thus the cancer. Hence, the obstruction of those hormones may ideally stop or stun the growth of the parading cancer. Human epidermal growth factor, HER2, is an oncogenic gene used in the study of invasive breast cancer using 10 to 20% observance rates of sufferers. The HER2 antibody was used to label the HER2 proteins as it is a good prognostic factor, as it may indicate the possibility of a high-grade tumor spread, thus to see whether the overexpression or not is of importance. IHC for the HER2 produced a score of 2+, of which is regarded as a borderline, though not classified as positive.